Okay, so we're going to start our IPTS 3 presentation. My name's Mark Morrison. I'm a medical student at SLU.
My name is Nina Kaiser. I am also a medical student at SLU.
I'm Connor Lynch. I'm a pharmacy student at UHSP.
I'm Daria Molesky, and I'm in SLU's physical therapy program.
I'm Nick Stang, and I'm a medical student at SLU.
I'm CJ Butler, and I'm a physician assistant student at St. Louis University. And Ariel Stateman is also in our group, but unfortunately she could not make it tonight.
Alrighty, so I'm going to start off with a kind of a general background of the term radical belonging. Our group did like a research literature review on this topic, and there's a lot of different definitions. These are some of the definitions that we found during our search. So Louis Toward said it was encompassing social, academic, and democratic belonging as mutually constituting processes with pointed attention to subverting society's systemic denial of the belonging of students of color. Linda Bacon has her PhD in sociology, and she coined the term as radical belonging is when we allow people in our lives in all of their glorious uniqueness, where we don't have these ideas that they need to be a certain way in order to meet up with our approval, where we can recognize that humans are also quite fragile in the world. And then Martin Sandbu, he said that the broad definition of economic connectivity is crucial. It is the software of radical belonging. So the point all these authors are making is that radical belonging is a framework that we can look at groups that are discriminated against and groups that aren't quite culturally normal per se. And it's a way to kind of promote equality and inclusion in multiple aspects of our current culture. So our group came up with this collective definition of radical belonging. It is radical belonging is an engaging framework to analyze equality and inclusion through all aspects of life. It requires our whole community to interweave diverse knowledges, strengths, goals, and needs so that every person feels a sense of belonging. This is a basic human need that must be perpetually strived for. So it's something that we can never fully achieve. It's something that we have to keep working at constantly. And so one way to describe this further is using COVID-19 as an example. You could write textbooks about this. So very briefly, African-American communities are more likely to have higher rates of underlying health conditions. That was before COVID-19. And using this radical belonging framework, you could say that they, didn't have the same sense of belonging to healthcare access or the same sense of belonging to healthcare trust, or even economic resources, and the list goes on and on and on. When COVID-19 hit, the mortality rates were 3 times higher for African Americans compared to white Americans. And a lot of these authors argue that we could start targeting this issue by focusing on radical belonging kind of to all marginalized groups and individuals. And then on our next slide, we'll talk about what we're going to do in this presentation, which is focus on radical belonging within the healthcare team during COVID-19. Burnout has been a pretty big issue since the pandemic hit. And so we've constructed a plan to enhance radical belonging through organizational, individual, and team level goals. So the background is that healthcare team members are already at an increased risk for mental health issues and suicidal ideation. So I got that ad from the IPTS assignment from University of Minnesota Hospital, kind of a plea to help because the doctors were struggling. And COVID-19 just increased that struggle. It increased stress levels as individual healthcare workers worked longer hours. They stepped in for their COVID positive teammates, and they also struggled to treat patients due to compassion fatigue. So our presentation is kind of using this framework to build a plan to combat fatigue and burnout amongst healthcare teams. So by utilizing a holistic approach of radical belonging, our group presents a plan to combat COVID-19 burnout at the individual, group, and team level. The healthcare team will be more effective and increase patient outcomes by enhancing the team's sense of belonging.
Okay, so we divided up our plan into three major categories: changes that we're going to make on the organizational level, changes we're going to make at the team level, and changes we're going to make at the individual level. So starting from the top, the organizational level, this is what kinds of how's the hospital administration need to change to try and tackle these issues? What kind of high-level policies can we make? So the first thing always needs to be assessing what the problem is, finding out from the employees what makes them feel valued at work, what makes them feel like they belong, what makes them feel like they were an outsider at work, what makes them feel like they don't belong, and how has the pandemic changed how they feel. These are some of the major points, but we're planning on asking many more questions like this inside surveys that we'll distribute to all hospital employees, full-time and part-time. Then once we have enough data, hospital administration can begin to hold monthly meetings where all staff members can voice any additional concerns that they have that might not fit into the open-ended questions that we're asking in the survey. So the goal behind this is not only to assess what problems need to be fixed, but also to increase transparency and build a kind of trusting, collaborative spirit between the administration and the employees. Employees need to feel that they are on the same team as the administration, that their voices are being heard, that even if there are problems, that people are working to try and fix the problems, and that they can be a part of that change. So hospital administration in those monthly meetings that we were talking about will discuss current plans to address the concerns and solicit feedback on the effectiveness of any proposed policy changes that they have. And then the final short-term thing that we can implement pretty quickly is to try and increase employee sense of belonging by holding interprofessional team social events to try and get the members of the healthcare team to understand each other more, to build support networks between colleagues, between coworkers, and try and foster a greater sense of belonging and inclusion. There's also many long-term changes that are going to take that they can't happen overnight. The one big one that we've seen over and over again every time that people are interviewed about the reasons why they're struggling during COVID-19 is the lack of staffing. The increasing staffing is a difficult issue to tackle. It's very expensive, and there are myriad reasons why burnout is high and why turnover is high in these kinds of positions. But the administration can directly do this by trying to increase hiring rates. And in the long term, trying to increase pay for lower income employees like nurses, aides, and environmental services in order to increase applicants. And we believe that this will start relieving the strain from healthcare workers that are higher up. Once with more nurses, aides, and environmental service workers, nurses will not be as stressed. Doctors will not be as stressed. Everyone will be able to focus more on the jobs they're supposed to do and less on putting out fires left and right. The second, we want to increase long-term engagement and commitment of employees. A lot of lower-income employees don't want to stay in this business long-term because they don't perceive any good career advancement opportunities. We can remedy this by subsidizing classes for lower income employees, your relationships with healthcare schools, and providing clear avenues for education and career advancement at all levels. Finally, we need to renew public support of healthcare workers. The administration can do this by funding advertising campaigns and public service announcements about effective healthcare practices. The resistance and hostility of the public to healthcare workers and their suggestions is a commonly cited reason for burnout and emotional fatigue. And we can address this by trying to change the public narrative around healthcare.
All right, so next is the team level. So starting with the short term, kind of the goal of the short term, our solution is to get the whole team to buy into the concept. So first, to do this, we're going to divide the healthcare network into teams based on the department they work in. So I figured that made the most sense. You're going to be working with them the most. So, and the second thing you're going to do is have initial team meetings where we have guest speakers kind of explain the concept of radical belonging, why it works, how it battles racism, how it increases patient outcomes, increases well-being of the employees, and decreases the burnout. And during this first short-term section, kind of have a team reflection on how prejudice has affected them and how it's affected their patients. So team members need to understand the racism they're working against, as well as understand the community and inclusion that we are striving to obtain. So next at the team level is our long-term solution. So ultimately, we're going to set up some bigger retreats for the team and have team members kind of reflect on their biases. Everyone has biases, and just kind of reflect on maybe some biases that each individual has, as well as talk about any prejudice that they've experienced or that they've seen patients or their fellow coworkers have experienced and how it's affected them. And just to do some activities that promote radical belonging within the team. So if you can have radical belonging within the team outside of the healthcare system, hopefully you can move that to within the system. Another team level thing that we can do is develop some free CME classes. This will encourage employees to get a deeper understanding of the socioeconomic challenges that their patients and employees and coworkers may face. And again, this will help just promote how radical belonging can improve patient outcomes and the overall well-being of the team. So some of the goals on the team level, the long-term goals will be to obtain a sense of radical belonging outside of the hospital so that it becomes natural to practice within the hospital for their patients and for their coworkers. And also give the team members a desire to pursue more knowledge, empathy, and understanding about the community around them.
Okay, so our recommendation to support radical belonging at an individual level involves providing free resources for mental health counseling, having therapists available 24/7. So just being available for same-day appointments or phone calls or text messaging if it's late at night. Also, it's important to provide the staff with adequate resources. So a good book is Radical Belonging: How to Survive and Thrive in an Unjust World while Transforming It for the Better. And it's also important to promote importance of wellness and trust management. So a good thing to do would be to have weekly wellness meetings and emails, which address just making sure that staff is taking care of their mental health and using their vacation days, making sure that they're taking lunch breaks and just taking time for themselves. So short-term goals would be to spread awareness about programs and resources, make sure that the workers know about these support programs, posting flyers with phone numbers of whom to contact regarding counseling or where to go to get more information in break rooms and staff rooms. So a good thing too would be to send out emails occasionally, like the weekly wellness emails with contact information. And then long-term goals would be to have the staff actually using the resources. And to do that, we could do monthly surveys and get feedback whether the program is being used or not.
So we all know that COVID has disproportionately affected different communities and different individuals from a variety of backgrounds. And we wanted to make sure that our mechanisms of change would really support these individuals or communities as needed. So on the organizational level, having the interprofessional social interactions would offer opportunity for members to know each other at just a more personal level, with the hope that building these relationships would enhance empathy and kindness, and knowing someone's situation could help just have each person treat each other with a little more patience and respect, especially if you know what they're going through. In addition, increasing the staffing numbers would decrease the strain on employees who are more likely to be overworked, because the thought would be employing people in positions that are increasing burnout or where people are taking more shifts. On the team level, so having a group reflection would allow for members to understand the impact between different communities on a deeper level. This kind of goes back to the social interaction on an organizational level. But again, knowing just deeper thoughts among team members would kind of enhance community and enhance teamwork and kind of create more of a team versus the pandemic, rather than the struggle of facing issues with the pandemic individually. In addition, using guest speakers from different backgrounds is really important, because it would just allow for greater educational perspective for everyone listening to these speakers, just to hear about how COVID could uniquely impact someone in a way that others might not have thought about or realized or experienced themselves. And lastly, having individual counseling that is available along with individual resources is really important, because each person can take or use these resources as much as needed, or use counseling as much as needed. So it's kind of tailored to each individual's needs.
So to measure metrics of success and sustainability, we could monitor employee and patient satisfaction using surveys. We can assess healthcare worker retention. We can provide open forum feedback sessions so that we make sure that everyone feels heard and is heard. We can monitor the quality of patient care and assess for race-based discrepancies in care. And we can assess the percent of staff using the CME courses and different forms of therapy that are provided. And a positive environment demonstrating radical belonging can retain quality members of healthcare teams, improve patient care, and increase trust within the patient community at large. Continued commitment of these simple values will allow a sustainable, positive environment, which can easily be adopted in other settings outside of our healthcare field.
So a little bit about what we learned throughout this process is that effective teamwork involves collaboration, participation, and communication. Throughout our first 2 cases and then working together on the 3rd case and presentation, I've learned that we all have important roles as healthcare professionals and can contribute that to the team. We all have our areas of expertise and demonstrate different strengths, but being a good team member is just as important for our patients. The best patient care involves interprofessional communication and collaboration, so practicing that in this setting and learning more about each other's roles on the healthcare team will only help us when we are out working together with actual patients. In this particular case, we discuss radical belonging and the importance of diversity and inclusion in healthcare teams. We discuss ways to understand, reflect on, and promote radical belonging in healthcare systems. This topic will be important for us to reflect on and carry forward in our future careers.